Pro Group Management, workers' comp that works for you.
Welcome to Nevada Newsmakers. On the broadcast today, there's a brand new hospital coming to Northern Nevada. The CEO, Alan Olive, joins us of Sierra Medical Center, here for the whole show on an all-new Nevada Newsmakers.
Hello, is this D&D Roofing?
Yes, it is. How may I help you?
You did such a great job on my roof. May I speak to the owner?
I am an owner.
Oh, can I speak to your supervisor?
Sure.
How may I help you?
I love your work. May I speak to the owner?
I am an owner. We're all owners. Well, that's why at D&D we work so hard to keep your home safe and sound.
Oh, no wonder.
D&D Roofing and Sheet Metal. Local, employee-owned, here for you.
Retail's impact on Nevada's economy? Enormous. 8,600 businesses, large and small, employing 145,000 workers. And last fiscal year, retail paid tax on nearly $60 billion in sales. We're the Retail Association of Nevada. We support retail, we help it grow, and we mean business.
RANNV.org.
Take a look at Pro Group Management and see how your workers' comp requirements can be met head-on. By taking a proactive approach, Pro Group can assure that your company is meeting or exceeding state and federal standards. As you move forward in your industry, Pro Group moves with you, simplifying regulatory tasks, clearing the way so you can get the job done and look to your future success. Pro Group Management, workers' comp that works for you.
Early in the morning or throughout the night, professional truck drivers are on the job, serving you, safely moving freight that's crucial to our economy. From the oldest industries to our newest innovators, from the exotic to the everyday, trucks are everywhere, moving everything. Never afraid to embrace a future that makes Nevada and our nation stronger. Trucking moves America forward.
Nevada Newsmakers Studio is located at the headquarters of the Nevada Trucking Association. Motion and purpose are a truck's greatest virtue.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And back on Nevada Newsmakers, we're delighted to welcome to the program for the first time Alan Olive. He is Chief Executive Officer of Northern Nevada Sierra Medical Center. Welcome to the program, sir.
Thank you, Sam.
For those that don't know, but folks who live in South Reno definitely know, there's been a huge building going up over the last couple of years. There's going to be a medical center here in the south part of Reno. Give folks an idea of how big this project is.
Thanks, Sam. The project's pretty significant, and it's been underway for probably about 5 to 6 years in the planning phase. We looked at a lot of planning data and growth information to determine, was there a need? And so definitely there is, and we'll talk more about that. But the project is on a 22-acre site. It's 300,000 square feet of a medical center with an adjacent medical office building, which is another 90,000 square feet. And it's provided quite a few jobs, construction jobs, about 1,500 construction jobs, which has really bolstered the economy, and will provide hundreds of positions and jobs for our clinical staff and physicians.
For folks to get a concept of how big that is, that's about the size of Meadowood Mall, about 500,000 square feet altogether between the two projects. You know, this area, I've lived here for a long time, and this area has always suffered from a lack of enough doctors, enough nurses, etc. What's going to be the situation as you get closer to opening, and I know you're looking to open within the month, in terms of staffing?
So maybe taking us back to the state of the state for healthcare for Nevada. So Nevada is challenged in a number of areas. It ranks 48th in the United States for primary care physicians for the population. It ranks 51st in regards to psychiatrists for behavioral health for the population. So those are challenges, and it's not just about a beautiful, brand new state-of-the-art hospital, but it's about the wraparound providers and the health system to be able to care for not just this community, but surrounding community as well. And so with that comes the need to recruit physicians, other providers, advanced practice providers, nurses, technologists, not only from within the market, but from outside of the market to bolster our region's need for healthcare.
Okay, and how is that going?
It's actually going pretty well. And so we've had many, many applications from nurses and technologists and therapists and many people from outside our community as people look to come to a beautiful place in which I'm a native of Reno. And so I'm glad to see more people coming in.
What's been the biggest challenge? Is it a question of pay? Because I mean, obviously this is an area where pay has been significant over the last few years anyway. And I should also mention that you run another facility, well, the company runs another facility over in Sparks, which is a smaller facility, I would imagine, than this one, correct?
Well, yes, there's Northern Nevada Health System is our health system locally in this region. It comprises Northern Nevada Medical Center, which has been in Sparks in our Northern Nevada community for 4 decades. Beautiful private room facility, which is a wonderful facility, received national accolades for many, many things. And so there's Northern Nevada Medical Center. We have Northern Nevada Medical Group, which has multiple locations in the Northern Nevada area, Sparks, as well as Reno, and in the rural communities of Northern Nevada. In addition to, we also have ambulatory care facilities with Quail Surgery Center, also with therapy offices, physical therapy offices. Also, we've opened up new services such as our freestanding emergency rooms. So one has been in operation for a little over a year, and that's in the Northwest at Mayan and McCarran, and provides amazing services for people who need emergency care services where they live and work. And in addition to, we also have Prominence Health Plan, which provides the services for insurance for Medicare Advantage as well as commercial populations throughout our region.
You know, it's been interesting over the last probably 20 years now. Renown has been a marketing giant and has been buying a lot of property, and is what was the former Washoe Medical Center, the county hospital, but it's grown much larger beyond that. But the reality of the situation is that your company is owned by Universal Health Services, which is a huge company, much larger than Renown, and will have a lot of weaponry to bring into this in terms of marketing and being able to get more business to your property.
That's a good point. Renown is a great organization, and we need them, and we need their services in our region. But yes, Northern Nevada Health System, Northern Nevada Sierra Medical Center is part of Universal Health Services. It's not only a national company within 36 states of here in United States, but it's also international and provides behavioral health facilities internationally as well as nationally, and acute care services. It's actually the largest healthcare provider in the state of Nevada.
Right, and it's got like 320, something like that, hospitals across the country.
Correct.
So it's huge. So does this, put out that there's going to be a battle, or is there enough business for everybody already?
I'd prefer to look at it as it's a preferred choice. Do people want to choose private rooms, as an example? That's one of our features of our hospitals here in the north, is private rooms for people. And as you can imagine, would you want to share your room with somebody else that you don't know? And it provides many other safety features. We'll get into that as well. But it's also a tax-paying member of our community, which provides that services and revenue to support our police, our fire, and the infrastructure here in our market.
Talk to me about safety features then.
So Northern Nevada Sierra Medical Center, we've added some, well, it's not only a state-of-the-art facility, but it added some additional safety features. So I'll give you a few examples. So if we think about COVID as an example, everybody's worried about infection control. So this new hospital, Sierra Medical Center, is equipped with also some infrared technology, robots that actually roam and go through and are pre-programmed to go to sanitize rooms to clean them, but also has indigo lighting. It's a light spectrum that actually impacts viruses and bacteria. And that's in place in all of our operating rooms, all of our procedural suites, as well as our emergency department bays as well. In addition, it meets all the newest code requirements of the 2018 FGI standards. So as an example, it has the highest seismic rating of any hospital in the state and probably in the nation. And so it's rated the highest in the nation for that. We've also added some features such as sound abatement technology, and it also includes other services and things that gives us more safety features, as well as, for example, energy. It's rated one of the highest for energy standards as well, about a 98% in energy standards. So it's all equipped with some really outstanding technology to provide not only a quiet place, but a safe place to receive care.
What is it going to do in terms of cost of health care? Because that's something that obviously, as everybody knows, people are concerned about. Is this going to maintain the level of cost we currently have? Is it going to lower it, potentially increase it? What do you think?
So healthcare, it's not just about a hospital, but it's about all the wraparound services. And so when we look at healthcare, it's about healing, it's about health, it's about nutrition, it's about prevention as well. So yes, this hospital provide amazing standards and provide competitive rates for insurances, and Medicare is pretty standard. It gives you what the rates you'll get, but also works with community companies as well to provide them effective rates. So when we think about healthcare, we also think about the starting point is staying out of the hospital by living a healthy life. And so we provide education, we provide many different tiers of facilities, such as telehealth, that allows patients to receive care when and where they need it via telehealth. Also, our primary care offices is in addition to our freestanding ERs that provide that level of care without having to go into a hospital. And so there's many different features and factors of healthcare to reduce cost and prevent things. And that's the first step. And then obviously working with our insurance and businesses to provide the most cost-effective care as well.
Do you think that there's been a missed opportunity through the government, whether it be federal or state, because you brought this up, in terms of other things that people should be doing beyond just washing their hands, in terms of maintaining their health? That, you know, diet and exercise and all these other things that would have benefited a lot of people who got hit with COVID, and they just physically weren't prepared to be able to deal with that.
You know, it's a unique situation with that, because if you look about the effects of COVID on any person, yes, there's comorbidities, which is one of the biggest impacts to the outcome of somebody's health. And so I think there's a lot of personal accountability as well. But obviously, I think whether it be a government, whether it be a community, whether it be a business, to promote health and wellness, that should continue to be one of our focus and features, so that we can maintain better health, to reduce the cost of healthcare, and when things like a COVID hits, we're in a much better position.
All right, let's take a break. We'll come back much more with Alan Olive after this timeout.
7 at 7 is available anytime, anywhere.
I'm Riley Smith with your Vegas Golden Knights. Watch 7 minutes of nonstop news from the Las Vegas Review-Journal.
Streaming on LVRJ.com and Twitter. Powered by the Las Vegas Review-Journal.
I'm Jeff Gehrman, an investigative reporter with the Las Vegas Review-Journal. I'm your guide for Season 2 of Mobbed Up, The Fight for Las Vegas.
You're in with every gangster and hoodlum in the United States.
I don't go for that, Mr. Kennedy. I don't go for that kind of action.
I was on television accused of fronting for the mob.
Subscribe to Mobbed Up, The Fight for Las Vegas, Season 2, today on Apple Podcasts, Spotify, or wherever you get your podcasts.
Modern boutique Ahern Hotel and Events Center in Las Vegas. Host meetings and events on 2 floors. Stay in luxurious rooms and suites. Unlimited branding opportunities. Regional Italian cuisine by Chef Mark Segrisi. Flexible event spaces. Full buyout options. Visit ahernhotel.com today.
Before the masks, before the distancing, before the world changed, UMC was ready. Our response to COVID-19 began before the crisis did, with our own team of infectious disease experts who've spent their careers planning for this moment. With a pandemic response plan, we'd practiced again and again, and by blazing new trails in large-scale testing, including every patient we admit. Always ready. UMC.
7 at 7 is available anytime, anywhere.
I'm Riley Smith with your Vegas Golden Knights. Watch 7 minutes of nonstop news from the Las Vegas Review-Journal.
Streaming on LVRJ.com and YouTube. Powered by the Las Vegas Review-Journal.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Alan Olive. He's the Chief Executive Officer of Northern Nevada Sierra Medical Center, the brand new hospital that's going in South Reno. It's interesting, over the last few years, you saw Renown pushing south, and you saw the Carson Tahoe Hospital pushing north, because they're not that far once you get through the Washoe Valley to get into South Reno. So what is this going to mean, do you think? Is there just a benefit to the public that they have all this choice now?
Well, there's always a benefit when there's choice and competition for healthcare for any service in our market. So the position of this hospital is to be geared around being near a freeway, but also being near McCarran, so that it provides access points. And it's a regional medical center. It's not specifically about a certain part of the community, although it does definitely benefits people who live in the center part of our community. I grew up here as a kid. I went to Worcester High School just a few years ago. At least I like to think that.
Okay.
But and we've seen the community change and grow. We've looked
tremendously.
We've used studies to look at the expansion of the growth in this region. We've used the EPIC study that was performed by EDON as well as UNR to look at where we should position healthcare services. And so this benefits the entire region, and it provides a very convenient access point, being near McCarran, being near the freeway.
Yeah, and for those listeners and viewers in Southern Nevada, McCarran is like the 215 is in Southern Nevada. It's a ring road that goes around the whole valley. Are you going to be designated a trauma center?
No, not initially. I think for our community this size, a level 2 trauma center, which Renown provides, is sufficient for the needs of our community at this time. It requires at least about 1 million population in the kind of the tertiary area, the larger demographic area, for it to be considered a need for another trauma facility.
Let me ask you about telemedicine, because there was some discussion in the media about whether telemedicine was going to continue on, because it was obviously in practice during COVID. It strikes me as the most efficient way to really clear the books for both the patient and the doctor, with the exception of doctors who like to have the in-person contact and actually see you and be able to shake your hand, etc. What's the legal status with telemedicine, and where are we heading with it?
So telemedicine's been in the community as well as in the nation for actually quite a few years, and we've had telemedicine for years, well before COVID. Obviously, COVID exposed the need to expand those services. So one of the beneficial things that the government did was increase the rates of coverage to pay for telemedicine. That was one of the barriers earlier, is even though it was the most efficient, cost-effective way to receive care, that was not necessarily done by the government and other payers, but now it is. And I'm actually very delighted and enthusiastic about the fact that they're continuing that benefit and coverage. So I think telemedicine's not only here to stay, but it's here to grow. And it impacts things not only inside the hospital, but people at home and getting cost-effective care.
Medicaid. What are your thoughts on, because we have huge coverage in Nevada for Medicaid, but the reimbursement rates are much lower than Medicare even. So how does that work for you?
So that's, you're pointing out one of the key challenges for healthcare in this state. Medicaid in this state actually pays less than many, many states here in our country. And that's been one of the promotions and advocations of the healthcare systems, not only the Nevada Hospital Association, but as well as providers, so that people can be reimbursed to even cover their cost. Right now, Medicaid does not even cover the cost of many, many services and procedures and visits, inpatient as well as outpatient. So that would be one of the key things that we're going to continue to advocate for, is to improve the rates of Medicaid so that the access could be increased to providers, especially outside of the hospital, to prevent people from coming in the hospital unnecessarily.
Okay, so, but are you forced by law to take Medicaid patients?
If we're a Medicaid provider, then absolutely we accept the rates that are given to us. But it doesn't change the issue of access and cost, access and price, and impacting the services all across our state. So yes, we accept those rates because that is what's required, but we're advocating for improved rates, not only on the inpatient side, but on the outpatient side, for better access for people all across our state.
All right, let's take another break. We'll be back with Alan Olive after this timeout.
What do you count on? You count on your power every day. At NV Energy, we've always powered what's important to you, but we're not looking at the past. We're focused on the future. While our standards are high, our rates will remain low. And our commitment to renewables isn't just meeting standards, but leading the way. Because you can count on more than just your power. You can count on the company who brings it to you. That's our promise. You can count on it.
Southwest Specialties has been making the homes and businesses of Nevada beautiful for more than 20 years. Their experienced designers and craftsmen create the walkways, backyards, water features, and a variety of outdoor cooking areas that add curb appeal and value to your investment. Call today or visit them at their website and see how they can make your outdoor spaces special. Southwest Specialties, creative, distinctive, beautiful. As you know, Reno is booming. Toll's Development Company is helping it grow with insightful design and development, building community with every project, adding beauty, adding excitement, emphasizing our shared humanity. Reno is becoming bigger. Toll's Development is helping it become better, more livable, more enjoyable. To learn more, go to tollsdevelopment.com. tollsdevelopment.com. Brian Culpa Photography was born in the rolling hills of Massachusetts, and now he can help you experience the stunning beauty of Nevada in a whole new way through the power of flight. Flying has always been a passion for Brian, and at Brian Culpa Photography, he can make your imagination soar. Brian has the creative mind and tools to tell your unique story. Experience the bird's eye view at brianculpaphotography.com.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Alan Olive. He is the Chief Executive Officer of the brand new hospital that's going in South Reno, Northern Nevada, Sierra Medical Center. So, as I said earlier in the program, you're going to open up in the next month. What are you looking at over the next few weeks? What still needs to be done to get those doors open?
So opening up a new hospital is exciting, but there's lots of logistics as well.
To say the least.
Yes. So it's exciting to have so much interest and enthusiasm around opening the new hospital. So we have literally hundreds of doctors that have joined us, as well as hundreds of nursing staff and other clinicians. And so we're now running through scenarios, getting ourselves prepared, all the supplies in place, all the equipment in place, and going through all the policies, procedures, the scenarios of patients coming into the facility. The great thing about this is when you start a new hospital, you hire the most talented staff. Those who are really prepared and experienced in doing what they do best. So it gives me great enthusiasm as well as comfort to know that these are the people that are going to be providing care and services to our people in our market.
So are you getting a lot of people from United Health Services across the country applying to be part of this hospital? Because, you know, in the gaming industry, whichever is the newest casino property, everybody wants to move into the newest property. Are you seeing the same kind of response across the country?
We're getting people from all over the place. Actually, most of our applications came from outside of the state. And then obviously there's other people within our community as well as the South that are coming by. So We're all prepping to open the doors. We're going through scenarios called Journey on the Gurney. And it's a scenario where we're invited.
Sounds like one I don't want to be a part of.
Well,
no, I'm kidding.
But the Journey on the Gurney is there to test our readiness, and so and it's just a fun way that we can go through and make sure that we are prepared for day one.
Well, congratulations. This is a massive project. As I said, our studios are located in South Reno. We're just around the corner. And I know that all of the people who work here are excited to have a hospital opening up just around the corner. So I think it's going to be a very exciting project and obviously much needed for Northern Nevada,
Indeed.
Where it's been so tough for so many years to get even close to what is needed for medical care for the community.
Thank you, Sam.
All right, pleasure to have you on. Come back after you're open and tell us how it's going.
Will do, thank you.
All right, and we'll be right back. Brian Culpa Photography was born in the rolling hills of Massachusetts, and now he can help you experience the stunning beauty of Nevada in a whole new way through the power of flight. Flying has always been a passion for Brian, and at Brian Culpa Photography, he can make your imagination soar. Brian has the creative mind and tools to tell your unique story. Experience the bird's eye view at brianculpaphotography.com.
Hi, my name's Marilyn Miner, and I'm sure you'd agree that Nevada's a very special place to live. I was born here, and my husband and I have raised our family here. I feel it's a privilege to live and work in the Truckee Meadows. I especially enjoy helping my clients reach their real estate goals. Sometimes the smallest details provide the greatest satisfaction. I'd be complimented to talk to you about your next move.
Call Marilyn Miner at Dixon Realty, 742-1280, or log on to marilynminer.com.
Safety. We all think about it. You think about it when he buckles in, when you check your mirrors and put away your phone. RTC thinks about safety too. In fact, we create it. Center turn lanes mean fewer blind spots. Bike lanes keep cyclists and you safe. Roundabouts reduce injury collisions, and all these crosswalks are designed to keep families like yours safe. Safety is your priority, and it's ours too. Every day, in everything we do.
Pro Group Management is the place where companies can find workers' comp solutions that are designed to meet their specific business requirements. As regulations evolve, Pro Group takes a proactive approach to clear the path to make sure your business stays ahead of the curve. Knowing your workers' comp program is optimized, you can focus on other important matters related to your growing business. Pro Group Management, workers' comp that works for you.
Don't forget, another way of watching Nevada Newsmakers is to subscribe to our YouTube channel, Nevada Newsmakers on YouTube. We'll see you on the next broadcast.